Good evening and thanks for staying tuned. Welcome to our COVID-19 update. Here are the highlights at this hour. Federal government asks administrators of its health facilities to prioritize testing and isolation in COVID-19 case management. States ask federal government to fulfill financial promises to assist in COVID-19 response strategy. And Australia to offer COVID-19 vaccine free to its citizens when it becomes available. I am Ladi Akiridolale. Once more, welcome to the program. The Minister of State for Health, Senator Olorinimbe Mamora, is asking chief medical directors of federal medical centers across the country to prioritize isolation and testing for COVID-19 in their various facilities. The minister made the call on the sidelines of a meeting in Abuja with some newly appointed chief medical directors of federal medical centers. According to him, isolation, testing, and treatment remain critical in the management structure of COVID-19.
In COVID-19, one of the main things you need to do, if not the most important thing, is to test. Because the majority, over 80% of cases, they are asymptomatic. That is, what you can call healthy carriers. They have it, you don't know until you test. So that's why testing is critical in the management pillar of COVID-19. You must test. So it's in that regard that our federal medical centers, they are doing their best. A good number of them, they have isolation centers. A good number of them, they even have treatment centers as well. A number of these FMCs, they do. So that's what you expect of them. And once you test, you isolate, and if you need to also, treat, go ahead and treat when symptoms are.
The acting chairman of the Nigeria Commissioners of Health Forum, Dr. Betta Adu, is calling on the Presidential Task Force on COVID-19 to redeem its promises of assisting states with finances and logistics in order to enhance their responses to the COVID-19 pandemic. The chairman, who doubles as the Commissioner of Health in Cross River State, made the call in Abuja, where she notes that many states do not have the needed capacity to scale up sample collection and testing, reason why many laboratories across the country are underutilized. She also appeals to the federal government to make available to states the Basic Healthcare Provision Fund so that the states can effectively respond to their healthcare needs.
We were very happy when the PTF announced that they would be supporting states with close to 2.1 billion to get the COVID-19 response really running back across the states. This is very important, and we believe that the release of this funding should be done almost immediately if they have not started. And this is because states are at their wit end. A lot of states saw it as a sprint race, and so it was soon going to come to an end. But with what is going on right now, we understand very clearly that it's a marathon and states are already exhausted. I would want to state this. Most states have difficulties with logistics. They don't have the vehicles to move these samples down to the reference lab, or they don't even have the funding. If they have vehicles, they don't have funding to fuel and manage all other logistics to move the samples down. So people just depend on when a suspected case comes down with signs and symptoms, and then they show up at the nearest health facility, and then they take it from there, rather than going into the communities to do active case search. We believe that if fundings are made available to states, surveillance would increase, active case search would increase.
A team from the Nigeria Center for Disease Control, led by its Director General, Dr. Chikwe Ihekwezu, has been inspecting health facilities in Akwa Ibom State as the state combats the COVID-19 virus. The team went around the Emergency Operations Center, isolation wards, laboratories, and other facilities built by the state government to improve healthcare delivery during and after the COVID-19 pandemic. After the tour, Dr. Ihekwezu called for increased collaboration at all levels to stay ahead of the virus.
The challenge to Akwa Ibom is a challenge to Nigeria, but I think it has put health on the political agenda more than ever before, and I think the Honorable Commissioner will agree to that. And our responsibility now as leaders in the health sector is to make sure that we continue persevering, because this is a very tough response. But we know that there will be a better future for all of us out of this. So we use the opportunity of this crisis, make sure we deliver on the crisis, prevent as many cases as possible, diagnose as many as we can and manage them effectively, prevent deaths as much as we can, but critically, build back better for the future. Make sure that we leave our state and our country in a better place to respond to similar outbreaks way after this one. It's a lovely facility, lovely building, but what makes an EOC is the work that happens in it. So I've challenged the colleagues working here to take it as a responsibility to keep this place alive, learn the techniques and working of an EOC, and develop it further. But we look forward to really collaborating, strengthening the already existing strong collaboration between the federal government, the Presidential Task Force, the Nigeria Center for Disease Control, and the good people and government of Akwa Ibom State.
Commercial flights have resumed at the Dambaba Suntai Airport in Jalingo, the Taraba state capital, more than 4 months after it was closed due to COVID-19. This followed an inspection by the Nigerian Civil Aviation Authority on the standard measures to curtail the spread of the virus. A visit to the airport shows markings for physical distancing, as well as provisions of personal protective equipment. The manager of the airport says they will not tolerate anyone who tries to breach security measures put in place by the authorities.
We have a standard procedure from Nigeria Civil Aviation Authority, NCAA. We follow their guidelines strictly. We put almost everything in place to make sure that we curtail the pandemic. As you can see, if you are coming in by the gates, there is a synergy that is placed there. We've tried to enforce the mandatory use of face mask at the premises of the airport, or you're coming in. You must have face mask. You must wash your hands and use sanitizer. Then spacing, as you can see, at the departure, entry and exit, the arrival, entry and exit, you can see the mark on the ground for spacing. And you can see the washing trough there on the running water for people to wash their hands. And at the parking lot here, you can see we've now closed down a space in between the parking space to space the car parking.
Meanwhile, as international airports and flights prepare to open in the country, COVID-19 protocols and testing are essential. The Murtala Mohammed Airport in Lagos has received additional infrastructure to cater to the new normal for passengers. Our next report takes a look at protocols at global airports and what Nigerian travelers should expect.
Many countries across the globe are resuming international travel operations as they evaluate and tackle their national risk to COVID-19 many months after the initial lockdown. Some are also ensuring that COVID-19 tests are done on arrival for passengers. Here in Nigeria, the Minister of Aviation announces August the 29th as the resumption date for international flights, with Lagos and Abuja airports taking the lead.
What we have become used to, physical distancing, wearing of masks, washing of hands, temperature taking, etc., will continue.
COVID-19 certificates and testing will be sacrosanct.
Just before you depart, you take a test. Hopefully you are negative and you're not showing any signs of COVID, then we board you on the flight. You'd have filled online your health questionnaire. And then when you come, you arrive in Nigeria, go through all the protocols and you exit the airport. So the 8th day after your arrival, which we would have considered the incubation period, may God forbid, you may show signs of COVID, and then you take a test at that time on the 8th day.
At the Murtala Mohammed International Airport in Lagos, a canopy now covers the exterior, and protective glass barriers have also been placed on the check-in counters as part of preparations for the reopening.
We put in shield at the counters just to set a barrier between the passengers and the operatives. We've done the physical distance marking. We are working on our toilets. We've done the canopy outside to shield people because of the measures, public health measures that we're taking place outside. Temperature measuring, bag fumigation and all those things.
Nigeria's international airports have been shut since March 23rd to all but essential international flights, while domestic operations resumed on July the 8th. Bukola Jo Uketumbi, Channels Television News.
Let's now talk to aviation expert, Mr. Tayo Ojuri, who joins us from our Abuja studios. Good evening, Mr. Ojuri. And as we did say the last time you were here, we did touch on the subject of international flights. Now, the plunge has been taking. They're to start on the 29th. Why are international flights so important to the health of domestic aviation?
Thank you, Ladi, and it's a pleasure to be here. International flights is very essential and critical to domestic flight operations because most of our passenger demographic is actually what you call business travelers. We have what we call origin and destination passengers, passengers that come here solely, and we're looking at 70% of passengers that are coming here solely for business. So when they come to business, there's that travel that goes from Lagos to Abuja or from somewhere international to Abuja, and we see lots of flight that's driven by either coming for approvals, coming for foreign direct investment, coming for more visiting families and friends, or life-changing events. So those flights actually bring lots of these passengers in, which terminate their flight travel into Nigeria, Lagos, Abuja especially. And so that actually drives local traffic and helps us to actually boost passenger traffic, which is about 30%. So having said that, we envisage that with the start of international flight operations, we're going to see a spike in domestic traffic numbers, passenger numbers. But in my opinion, and from surveys taken, we look at the trend might actually go up. We can see an elevation within the next 2-3 weeks of the opening of those airports because of those stranded at both ends and those that had open items to cover. But over and beyond that, we see that economic factors and the fact that people have now learned to do business in a new way. It's called the new norm of doing business, which is automated norm. That's going to actually affect travel for the next quarter or two.
The other thing, of course, is that since this announcement was made yesterday, in fact, even the aviation minister himself did make reference to this much earlier on in the process, where he said, look, a lot of pressure was being mounted for international flights, but that many of the flights that originate in Nigeria cannot really go to many of the places that most Nigerians want to go yet. Nigeria is not yet allowed to go into the EU. It's not yet allowed to go to the US. That is, flights from there are not yet allowed to do that. So what's the hurry? If that is still the situation as at now, is this really a game changer then?
Yes, it's certainly a game changer because we have lots of Nigerians in diaspora, which is a driver for the traffic. We have lots of Nigerians that have dual nationalities, that need to move back and forth. That's a game changer. However, what's essential into what you've actually highlighted is that fact that instead of a 3 daily flight, we're going to see that cut back to 2 flights for those international flights weekly, rather than everyday flights. So that's where the difference and the game changer is going to be. There's going to be a decline in the daily flight, decline in passenger, but there will be that freedom to move, and that's going to actually affect business as well. Don't forget, we have lots of people that lots of passengers actually that go for trading as well. So that's been actually experienced a dull since March. So with the opening of international routes, we'll see that frequency open and we'll see a growth in that process.
Before the lockdown that necessitated the shut of the international airports on March the 23rd, quite a number of travel agents who are critical stakeholders in the aviation process had sold quite a lot of tickets and had remitted the money to the airlines. People were holding such tickets, they couldn't fly. They demanded refunds from their travel agents to whom they paid, and those in turn explained that, look, this money has gone to the airlines. With this reopening, do you see a situation where that issue would naturally resolve itself, or are we looking at a situation where this is an opportunity for more rancor?
It's actually not a Nigerian peculiarity. With the COVID-19, that became a global issue. Where you actually had lots of airlines and credit card companies and government interference, where government actually had to interfere across the world with IATA being on the table with them to actually give options to passengers. One of those options was refund, a full refund, and in cases they couldn't refund, they offered vouchers. So the third option was if you couldn't get a voucher, you got an extension of that ticket. So you have these three options, and what is now being made so that we can actually engage the passengers and build that confidence and ensure that they come back to fly, because we certainly need the passengers to fly. That's where we derive the funds and the revenue for aviation sustainability from. So what we see with the opening of the airports, with people using those tickets, it's going to give us revenue within aviation sector, and then with the comfort level, people will continue with their daily, their usual travel schedules, but we still don't see that this will actually improve over time. There will be a decline, and the numbers will not be pre-COVID-19 until about 2023.
Wow. Now, that brings the issue of palliatives up. There was a sum of money that was promised, although that is now in contention, but that sum of money was promised to the aviation industry as a way of helping some of those who were very badly hit, the airlines, the travel agents, and other such sundry stakeholders, to survive. Now, with international flights, it's a whole different ballgame, because the capital that is required for this is indeed humongous. Would you say that without that injection, given all what you have said so far, without that injection, the players are going to be handicapped to do what they need to do ahead of this international reopening?
Well, prior to the international opening, we still have lots of domestic airlines that are grappling with financial difficulties. So I don't think the opening of the international flights would affect them. It will not move the needle in such a very drastic manner. It will not remove the needle significantly for them to resuscitate. They still need that assistance from government. It's still being tabled within the financial committee, being headed by the vice president. So hopefully there's a finality on that process. And I know there's a central bank interest reduced loan offered to airline sector. All this put in place, if it's fast-tracked and put in place in ample time, that would actually give a lifeline to the aviation sector as a whole, not just the airlines.
Thank you very much, Mr. Tayo Ojiri, for your perspective on this matter this evening. Thank you for your time.
It's my pleasure.
Let's take a break, and when we return, we'll bring you up to speed with the latest of the figures of our COVID-19 case management, according to the NCDC. Please stay with us. Thanks for staying tuned. Welcome back to our COVID-19 update. 16 states and the Federal Capital Territory account for the 417 new cases of COVID-19 in the country, as Nigeria gradually inches closer to the 50,000 mark, with 49,485 total confirmed cases of COVID-19 across the country. The good news, though, is that the total number of recoveries are also on the rise, with 337 patients receiving a clean bill of health, bringing Nigeria's total discharges to 36,834, while deaths increased to 977, with 2 new fatalities in the last 24 hours. A breakdown of the latest figures across the 16 states and the FCT shows Lagos having 207 cases, Kaduna 44, Ondo 38, Abia 28, Anambra 21, Plateau 20, Bauchi 13, Oyo and Ebonyi 9, Delta and Edo 7, Enugu 6, Niger 3, Gombe 2, Ogun, FCT, and Kano 1 case each. Eateries in Ekiti State may have been regulating themselves before now, but the state COVID-19 task force is insisting that all rules guiding the pandemic response strategy apply to them also. The task force over the weekend closed down some airing hotels, supermarkets, and other places, and it says it will not go to bed in its regulatory and enforcement responsibilities. Babajide Agbeo gives us an update.
Restaurants and eateries also resumed in Ekiti State at the time government eased the lockdown around here. Much of monitoring or clampdown may not have been carried out around their outfits, but the state COVID-19 task force says it expects that they understand the rules and they have been following them. The task force is also prompting them to do the needful in case they have been airing, so as to avoid any unannounced visit that may lead to closure. In other areas, the task force has been going around to monitor compliance by institutions and different outfits. And this has led to the closure of some hotels, supermarkets, joints, and other places over the weekend.
And just this past Friday and Saturday, we closed down 8 pharmacies and supermarkets. They erred by not using the face mask properly. Or you're going in and they have a Veronica bucket and there's no water in the Veronica bucket. You know, they just place it in there as a figurehead. Or you have a restaurant, a pharmacy or a supermarket that's expecting 200, 300 people, and you have one small Veronica bucket. Okay? And or you are going into the place and the guard there does not, in fact, many of them did not have a infrared thermometer.
The supervision continues, and the minimum expectation from the people is compliance. Babajide Agbeo for COVID-19 update.
Meanwhile, in Niger State, restaurant operators have raised concerns over resistance by their customers to the COVID-19 protocols they have in place. They, however, say they are not deterred and are trying their best to adhere to government's directive on safety measures. Emperor Simon monitored the level of compliance in some of the eateries in Minna and brings us up to speed.
Among the measures rolled out by the Niger State government for operators of eateries to abide by is the compulsory use of face masks. However, in many of the restaurants we visited, what we observed is that customers come in without their face masks. As a matter of fact, there is no sign on the walls of the restaurant to mandate the customers to use their face masks. However, in terms of hand washing, most of the eateries have a washing hand basin in front of their business premises, and they mandate their customers to wash their hands before going inside. We spoke with some of the operators earlier in the day, and some of them say that it is something they're really ready to comply with.
We have been issued the guidelines for COVID-19 rules and regulation, and as a restaurant, we have been updated. We have been keeping up to date of those rules.
Immediately you wash, the next thing you go inside. Once you open the door, you know some people might actually have contact with the door. So rather than this, once you go inside, you sanitize your hand immediately you go inside and you get your food.
Efforts to speak with the Niger State Task Force on COVID-19 to respond to some of these issues proved abortive. Currently, Niger State has a total confirmed positive cases of COVID-19 as 232, with 12 deaths so far recorded. From Mina, Empress Simon for COVID-19 update.
In Bauchi State, there's begun an active community case search in local government areas bordering high-risk states, but there are many who still deny the existence of the virus in spite of several enlightenment campaigns. Our correspondent, Hajara Aliu, brings us the update.
Community testing has been extended to Toro local government area following the directive issued by the Bauchi State Governor to the COVID-19 Task Force Committee to commence active case search in Toro because of its proximity to Jos, the Plateau State's capital. The distance between Toro and Jos is just slightly above 30 kilometers, and Plateau has seen high numbers of positive cases of COVID-19. The state is gradually inching closer to 2,000 confirmed cases of COVID-19. So Toro is seen as a potential high-risk community. So far, 900 samples have been collected from Toro and 13 people have tested positive from 5 settlements. One issue that is mind-boggling is the issue of denial.
Okay, I think when you have belligerent presidents such as Donald Trump, describing coronavirus as a China virus, when you have Jair Bolsonaro in Brazil saying it's a small flu, people have mentors and they have every reason to disregard COVID-19, don't they? But like I said, more importantly, coming back to our own context, we have not seen our leaders, taking actions, reinvigorating our healthcare sector and making our healthcare facilities functional as a result of this pandemic. So a combination of these factors and many other factors, of course, people are likely to believe that this virus does not exist because we have not seen, measures put in place to actually contain the virus and to make sure our own healthcare sector remains functional in such a way that pandemic of this nature will be, taken care of. Look around, look at what is happening across nook and crannies of Nigeria. To what extent has this COVID-19 actually pushed our leaders to be able to make our healthcare facilities functional? That is a fundamental question. And you have them again, doing all sorts of conferences, conducting all sorts of meetings. Sometimes elections are held in other states. And even in our state, in some days to come, local government elections will be conducted. So how are these, for example, going to send what signal is that sending to our people to convince them that, look, COVID-19 is a very serious pandemic. You should adhere to all the health protocols, all the health guidelines.
Enlightenment campaign is still going on, and the recent one was organized by a group known as the Northeast Youth. From Bauchi, Hajara Aliu for COVID-19 updates.
Let's talk to Dr. Tolu Olufunlayo, as a consultant public health physician. She joins us via Skype. Good evening, Dr. Olufunlayo. Thank you for your time this evening. Okay, I understand we seem to have some challenge with linking Dr. Olufunlayo. While waiting to reconnect with her, let's go outside our shores and okay, if Dr. Olufunlayo is there and she can hear me. Dr. Olufunlayo, can you hear me? Okay, while we wait for that, let's go outside our shores and talk about Australia's Prime Minister Scott Morrison, who has promised the people free vaccines if clinical trials of one prove successful. The vaccines are being developed by pharmaceutical company AstraZeneca and Oxford University. Mr. Morrison says the government will be able to offer free doses to its entire population of 25 million people. The vaccine is one of 5 promising candidates to reach an advanced stage of clinical trials. Meanwhile, the World Health Organization has pointed out that the coronavirus pandemic is being exacerbated by countries putting their own interests ahead of others in trying to secure supplies of a possible COVID-19 vaccine. The Director General of the global agency, Dr. Tedros Ghebreyesus, warned against vaccine nationalism. Here's the global update.
The World Health Organization also says it is concerned that the novel coronavirus spread is being driven by people, young people, that is, people in their 20s, 30s, and 40s, many of whom are unaware they have been infected, posing a danger to vulnerable groups.
This increases the risk of spillovers to the most vulnerable, the elderly, the sick, people in long-term care, people who live in densely populated urban areas, and underserved rural areas. We must redouble efforts to stop the virus from moving into vulnerable communities.
Here's a look at the situation in other parts of the world. In Germany, Chancellor Angela Merkel has called on Germans to stick to the coronavirus rules, such as wearing masks, to ensure public life can be as open as possible. She warned, however, that a recent rise in coronavirus cases had been caused by greater mobility and more personal contact, and that she did not think now was the time to ease restrictions any further.
Protect people from the threat of coronavirus.
The UK's Health Secretary Matt Hancock says England will scrap the government agency responsible for responding to public health emergencies after the country has suffered the highest death rate in England from the coronavirus pandemic. Public Health England, a cornerstone of the state-run health system with responsibility for managing infectious disease outbreaks, will have many of its functions with the government's contact tracing service into a new body to be known as the National Institute for Health Protection. South Korea has tightened its social distancing rules, having reported a 3-digit increase in novel coronavirus cases for a 5th day, and authorities scramble to trace hundreds of members of a church congregation. 2 days after imposing stricter social distancing in Seoul, the capital, the government expanded the curbs to include the port city of Incheon and banned all in-person church services and indoor gatherings of 50 people or more, and outdoor ones of 100 or more. And Australia's second most populous state of Victoria has reported its lowest daily rise in new coronavirus cases in a month today, stoking hopes that a second wave of infection in the state is easing. The state, the epicenter of the latest COVID-19 outbreak, recorded 17 deaths from the new coronavirus in the last 24 hours. A day after recording its deadliest day of the pandemic with 25 casualties. It reported 222 cases, compared with 282 on Monday. Finally, in the United States, some schools are once again turning to online learning as the number of COVID-19 cases in the country reached more than 5.4 million. As the pandemic situation is growing, more die in the country, some reopened schools were forced to switch back to online learning following campus COVID-19 clusters.
We'll take a break. When we return, we'll hope to make sense of much of what is happening both locally and internationally. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. Let's see if we can talk now to Dr. Tolu Olufunlayo, consultant public health physician. She joins us by Skype. Good evening, Dr. Olufunlayo, if you can hear me. Thank you for your time.
Thank you.
Let me start off before we get into the main topic of today's discussion. Let me ask you about a couple of things that have arisen. There is some fund which is said to have been budgeted for federal medical centers and teaching hospitals in the growth plan, sustainability plan of the federal government. Now, given where we are with the COVID-19 pandemic as of today, what would you immediately say that kind of money should go towards?
Could you say the last thing again?
I said, what do you think that kind of money should be spent on? Yes, I can hear you. What do you think that kind of money should be spent on?
Okay, yes. Oh, there's so many. Okay, Ladi, thank you. Good evening once again. Quite a number of things, increasing testing capacity, of course, strengthening the surveillance system, and of course, providing more material cases, there will be need for more care centers. So, and of course, for research, we need to do research so that we can also be, able to produce our own medicines, our own vaccines, and so on. So, our health system was weak. So we need a lot of strengthening. Lots of strength.
Let me jump in right away and ask you then about international flights resumption. I know that we had talked a little bit about this when domestic flights resumed, and we said, okay, we'll wait until the announcement for international flights are actually made. Now they've been made. What would you, step by step, what would you recommend that they do between now and that 29th date for those who will be utilizing the international flight option to be safe?
Okay, great. Now, as we know, the aviation sector is a very highly regulated sector, and they have quite a bit of structure in place. And they've more or less done a test run with the domestic flights having reopened. So for the international flights, really, they just have to go back and look through the plan. But I think one area that, apart from, well, it's a multi-layered response. So we're going to be looking at a lot of different measures. But apart from issues of checking temperature, testing passengers, looking at issues of physical distancing at the airport, sanitizing, and so on, I think one area we haven't really spoken about much is that staff will need to be trained, both staff at the airport and staff on board. It will be very important for them to be trained on IPC, that's infection prevention and control, so that they would know how to manage issues that pertain to, prevention and not be part of spreading it. So that's really key. I think apart from that, it would be really what we have been talking about already.
Well, it would appear as if that there might be some significant differences. Let me give you an example. It is one thing to say that someone should put on a face mask in an aircraft for a 1-hour flight from Lagos to Abuja. It's quite a different thing for someone to put on a face mask for a 5-hour or 6-hour trip to the UK, or an 8 or 9-hour trip to the US, or even longer trips elsewhere. These are some of the challenges that may crop up. How do we go around these?
Okay, yes, the length of the flights are an issue. Now, I must say that despite the fact that wearing a mask, a medical mask or a face covering may be uncomfortable, however, for those of us in the medical profession who have had to wear masks prior to the advent of COVID-19, tests have shown that masks do not significantly decrease oxygen concentration, so people can still breathe. So we need to explain to passengers that despite the fact that it's uncomfortable, they need to keep their masks on, excepting where necessary. So, for example, on a long-haul flight, there will be need for them to eat. In terms of food, the food preparation will have to be such that there will be minimal contact between the staff and the passenger. So maybe pre-packed food that will probably be just handed out in the cabin. But the thing is, maybe passengers will need to come with several masks, or maybe they'll need to be provided with additional masks so that when they take them off, they won't have to keep handling them and put them back on, which may encourage infection transmission. So, of course, another thing again is use of restrooms. In the short-haul flights, I think the restrooms actually were not even available on board. But in the long-haul flights, that can't work because they would definitely need to use it. So there would need to be proper crowd control to reduce people crowding as they go to the restrooms. And another thing, of course, is that if proper screening is done prior to passengers boarding, that is, you don't have people who are obviously ill, and of course they've had tests to show that they are most likely COVID-free, I mean, as at the time of the test, then when they're using it, the regular cleaning and disinfection will be all that would be needed to make them safe for other passengers. So, of course, cleaning of high-touch areas, and that's why I say that the staff on board, the cabin crew, would need to be trained in proper IPC, so that if they do need to clean and disinfect any restrooms or any surfaces, they would not do it in a way that would now transmit infection, but would rather limit the spread. So I think these are some of the areas that, are different on a long-haul flight.
As you were speaking there, you touched on the issue of the cabin crew themselves. If what goes on the ground is anything to go by, they themselves are as susceptible as everybody else to any of these infections, because they are the ones who are having to deal with these groups of people coming into their aircraft for long periods of time. So how do those people, as well as the flight crew, now talking about the pilots, the co-pilots and engineers and so on, how do those ones ensure that even while doing everything they have to do to make the passengers comfortable, they don't expose themselves either?
I think what is very important here is proper training. Training in infection prevention and control. In as much as COVID-19 is a very infectious disease, it's also something that is quite susceptible to preventive measures. So they need to be properly trained as to how to handle passengers. A lot of barriers would need to be put in place. I mean, physical barriers, for example, maybe use of medical masks and shields. And they would have to have much less contact with passengers than they used to have in the past. So I'm sure quite a number of the things like in-flight magazines and other materials that used to be placed for passengers might not be available. And maybe they won't be able to attend to all the needs of passengers as they would on a regular flight, just to cut down the interaction. But they themselves must be physically and mentally stable, so they need a lot of support and a lot of training. If this is done, then we would be able to minimize infection where there is any potential for that on board.
Are you hopeful that all of this will be complied with? I know that sounds like a trite question, but I'll tell you why I ask. I ask because on the ground, over the last almost 6 months, it will be 6 months around the end of August since COVID-19 made its entry into Nigeria. There's been very limited compliance. There's been massive flouting of the rules, complete disregard. Even the domestic aviation you talked about that has been used as a test case, there were cases where, VIPs and other such highly placed people were accused of breaching the protocols, in some cases allegedly assaulting some of those who were trying to enforce those protocols. Now, if that was what happened domestically, what hope is there that the international is going to be any different?
Well, this is always a challenge when it comes to human behavior and personal responsibility. So again, it's going to have to be a balance between persuasion and enforcement. Now, there's only so much of enforcement that a few cabin crew can do on board. But I think we need to appeal to the collective good of people traveling, that if you want to protect yourself and protect others, you need to keep this mask on. I mean, you need to self-declare if for any reason you get to the airport and you suddenly feel unwell, and so on and so forth. It's not easy, but if you want to embark on such a journey, I mean, this is a long journey. I think you should just be considerate of other passengers. So we just keep on, appealing to people, and then some level of enforcement. I know that cabin crew do sometimes go around and say, please do this, please do that. Occasionally, we've seen some very difficult passengers, but usually with some persuasion, people usually do comply. But it won't be total, and that's why we have to have a multi-layered approach to be able to take care of those areas where, unfortunately, a few people might, not comply. But we are hopeful that, in cases like this, people will be more responsive, more responsible, and see the collective good in complying to these regulations for the few hours that they will be on board the aircraft.
All right, then. Thank you so much, Dr. Tolu Olufolayo, for your time and for your perspective on this very important, very sensitive topic. Thank you for your time tonight. That's our package on our COVID-19 update for tonight. You can take a closer look at some of our global numbers in real time, talking about the COVID-19 numbers. Visit our website, channelstv.com. There you'll get more updates and a better understanding of all that there is to be done to stay safe during this period and thereafter. There are also figures on recoveries in Nigeria, Africa, and indeed around the world. And of course, there are other stories on politics, business, and sports. I'm Ladi Akiridulade. Do stay safe and good night.